Hello, everyone. Welcome to our Mother's Health podcast. In today's title, we are looking at silence before motherhood, sexual and reproductive health among Afghan girls. This is a very interesting topic, and around the world, millions of girls enter womanhood without information, protection, or the freedom to make decisions about their own bodies. For many Afghan girls, conversation about things like menstruation, sexual health, puberty, reproductive rights, and bodily autonomy remain deeply silent and is shaped by the culture, obviously, conflict, poverty, displacement, and restriction. But silence does not remove the need. It only increases vulnerability. So welcome to our Mother's Health podcast, everyone. I'm your host. I'm Dr. Vivian. Today, we'll be discussing sexual and reproductive health among Afghan girls and the realities, the stigma, the barriers, the urgent need for safe conversation and support. And I'm joined today by a very special guest, and his name is Mr. Nabi. Mr. Nabi will be introducing himself. So thank you for joining, Mr. Nabi. Can you introduce yourself?
Thank you so much. And it's a great honor of me to having me in this really important podcast. So I really appreciate it. So my name is Mohammad Nabi Ebrar. I'm basically from the south of Afghanistan, and I have been working in the health field from last decades. So I studied in this field. I worked in this field, and I will continue to spend my life in this field, as I see it's highly important, particularly supporting those who are in needs at the moment, especially the women, as we are going to discuss today and this issue. Thank you so much again for having me.
Yeah, thank you, Dr. Nabi. It's just such a pleasure. I can't say that enough, having you on this podcast today. Before we discuss healthcare, I think it's important for us to understand the wider cultural and social context. Can you help us understand what conversations around puberty, menstruation, and reproductive health typically look like for many Afghan girls? What does a culture look like?
Actually, this culture has been different from everywhere in the world. If you think about this, in Afghanistan, culture is more related to religious issues, which is most of the population. The majority of the population in Afghanistan, they strictly following religious rules. So. Regarding women's health, reproductive health, and sexual health issues, it's not just a cultural issues. Here, it depends and links to many other factors. For example, the most affecting factor is a culture and also awareness, like which is highly important for women to be fully aware of their bodies. Mm-hmm. And also is mostly linked to family and parents' education to explain the woman's body to their kids from kidshood, even adulthoods. So this we can't say it's just culture. It has different factors in the setting of Afghanistan.
Yeah. So will you agree with me, Dr. Nabi, that there's limited reproductive education and there's lack of trusted safe spaces for girls to have this conversation about sexual and reproductive health? Would you agree with me that that's a huge problem?
Of course, it is like lack of awareness among the teenage girls, and also cultural restrictions. We often see many families, many women. They feel ashamed when they explaining their concerns are and their health problems. We have seen lots of even adult women who already experiencing pregnancy, like they experience many times pregnancy, but they're not able at the moment to explain the problem, the health issues they're having due to dishonoring, due to feeling ashamed, or even at the teenage years old, like teenage, most are thinking if they want to explain their reproductive health problems, there might be punishment for them from their families. So most of the time they're avoiding. They just experiencing the hidden problems, which at the end becoming a huge health concern for every woman.
Yeah, absolutely. And this secrecy around sexual and reproductive health and about their body, I know, it can lead to a lot of health complications later because they are not free to discuss personal issues, because I think they believe that if they do that, it's against the religion. Am I correct in saying that?
Yeah, it is. It is correct. As I explained before, many factors affecting them in Afghan communities, particularly in rural communities here. So we are facing to lack of knowledge. We're facing to even I can rise this, facing to lack of healthcare providers. I mean, female healthcare providers. So lack of communication
Oh,
between
I
them.
see.
Yeah.
Yeah, yeah. So that's a key part then, having those female healthcare providers, because if they feel safer with women, especially young teenagers and women, if they feel safer with women, then and there's a shortage of women healthcare providers, and that's a huge problem, isn't it? Yeah,
Absolutely,
yeah,
absolutely.
yeah. So, as you know, there are consequences because of all of these setbacks and all of these factors that you have talked about. But can you educate us even further? What are some of the health consequences of all of these religious, cultural, secrecy, shame, and early marriages, lack of trust for trusted spaces for girls? What is the health consequence of this? Talk in relation to maternal health as well. What are the consequences? What are some of those things that you see that are the health consequences of all of these setbacks?
Yeah, regarding the consequences, of course, there is major consequences from this when someone is avoiding their initial problems at the beginning. So it will end up with a major and a very big problem, health problem. So when a girl lack accurate information about the first consequences that they may recognize as a dangerous sign. So, for example, a painful menstruation cycle, a heavy bleeding, severe cramps, or persistent irregular bleeding can indicate underlying issues, which guidance us that. If not treated or avoided the treatment, so or delaying the treatment, so it will be early mistreatment, or it will be an early sign of a dangerous disease at the end. So this will be like the first consequences is just avoiding early treatment. This is
Yeah,
the first consequences.
yeah,
So most of the time it's it's not explaining from them, not discussing with family, not discussing with a healthcare provider. So it's ending up even with a very high risk disease, including, for example, if we give an example, when an early pregnancy occurs, that links to early marriage. So yeah, this and the female, the women, they're not explaining their problem due to secrecy, due to silence, or due to any factors, the cultural factors that affecting her, that is increasing the risks for mother and child in the meantime. So accessing to antenatal care and skilled delivery services is crucial, and silence often blocks that access in this community. Yeah.
Absolutely, absolutely. Now let's take the discussion to young women, okay, teenage young youth, pregnancy risks among young girls. And of course, there's a lack of access to contraceptive, if I'm correct, in those regions. So young girls are unable, or young women are unable to access contraceptives because of all of the secrecy. So what are some of the complications that are consequences of that?
Of course, the lack of contraception is also links to the culturally affecting factors. That's silence, embarrassing themselves, that and feeling ashamed that if they want to discuss this. So let me tell you in a very I would say a very horrible issue. Like we have been faced to many teenage girls or young adult males, that when they're getting marriage and they're wedding to each other, they even don't know about the menstruation cycle.
Wow.
Yeah, many girls, they are attending their wedding night when they're having menstruation cycle, because they don't have the enough information about this. So when we have this kind of people, when we have this kind of lack of information regarding reproductive health information, so how it wouldn't be affect the overall health of their reproductive health system and other issues that they will face after the marriage. So of course there is lots of changes in the female body, like in childhood, in teenage years, after wedding, or while having a pregnancy. There is a woman is facing too many changes during this process. So not only women should have enough awareness regarding this. The man has also, it's also a man's duty that he must understand the situation. He must recognize the woman needs. He must recognize the woman priorities of women's health. So lack of contraception is a major risk factor for them as well. Many women, they don't want kids. I still remember. I would like to explain my personal story. I was in laboratory section at a hospital where I was working there. So we did a test of pregnancy for a woman when she had 5 kids. So when it becomes positive, she was crying in front of us. Then I asked her, "Why are you crying? This is something you can avoid. This is something stoppable." So then she's saying, "No, how it's avoidable? How I can do this? I don't want more kids. So I already have 5, and I don't have enough. For example, facing to economy situation, facing to family problems. So I already having that. So I don't want another one." So this was my personal story I saw by my own eyes, and it was really painful even for me. I still imagine how it was painful for her as well.
Yeah. So is that there's no access to contraceptives at all? You can't just walk to the clinic and get contraceptives? Is that what it is?
Yeah, in many places like Afghanistan is not fully covered by healthcare systems.
Okay. Yeah.
So there is lots of family in rural areas, and they don't have even access to healthcare facilities. But there is majority of families who are living to in the urbanization area. They have access, but they don't have awareness about this.
Oh, so there's a lack of awareness issue and there's an accessibility issue as well. So
Yeah,
yeah, so that's a huge problem.
yeah.
And also in like we've said, in many cultures, girls are taught in Afghan culture, girls are taught to stay silent about their bodies, and shame, of course, affect them a lot when they experience pain, when they experience abuse, and when they experience any reproductive health concern. But there's also the fear of dishonoring their family. And a lot of times when they experience these things, they don't want to share, especially if there's an abuse or something going on there, or there's an unwanted pregnancy as well. There's this huge fear of dishonoring their family. What can you say about this, Dr. Nabi?
Yeah, for this kind of factors, we can clearly say education is the most important things. First of all, that everyone should understand, and it's a part of prevention actually. So when our girls understand what is normal in their body and what requires care, they can seek help early before she faces to any consequences that reduce the complications and improves outcomes, especially for menstruation problem, menses problem, and also infections and reproductive health conditions. And in addition, education is also a safe decision making. It can give us the authority of safe decision making. When a girl learns about the consent boundaries and her body autonomy, so in the age of appropriate age, like teenagers, where they're better equipped when they're better equipped to protect themselves and recognize what's something not safe for her. It's not only just prevention the disease, it's also supporting the future health, including supporting the health system. So from a health care point, like we can say, education is doesn't replace medical services, but it improves how we, when a girl use them, and it can save lives, and it can save lots of. It can support the current health system, as we already having weak health system.
Absolutely. So in other words, you're saying education is protection itself. And, the education is not limited to just Afghan girls, just the girls. Is something that everyone should take part in. Men should take part in education. I like that you pointed that out earlier, because men also will need to support their women and their daughters as well to understand these things. And there need to be like a family support system as well to help women to access and seek health care. Yeah.
Yeah, absolutely, yes.
There's also the lack of language to describe symptoms, because obviously that comes from lack of education as well. Because if people cannot communicate their symptoms, then they can't really communicate how they are feeling about their bodies, and they can't communicate to yourself as a healthcare provider or professional, so that you could give them the right support that they need. So education is the protection in those environment is very critical, I would say. So why is education so important for girls' safety, well-being, and future outcomes? You've talked about that, but if you want to add more to that, I really appreciate it, because let's look at body literacy, let's look at consent also, and autonomy. Let's look at mental health awareness, prevention of exploitation, empowerment through knowledge. These are all what education can bring. So if you want to talk more about that, you're welcome to talk about that, why education is important.
Yeah, of course. Like if we would like to continue regarding the education, so it will take many hours, because it's something which can help us to open our eyes and our which we would be able to see everything clearly. So when we understand the situation, it's the only way. Like education is the only powerful tools for a human that use the bad and good ways. Either you follow bad or the good ways. So absolutely, education is the top priority for everyone. As I mentioned before, for male and women, not just we should focus on women that they need the education and awareness. Also, men needs this. It's a joint life. After marriage, it's a joint life. When woman is facing to health issues, it's suffering also male. So education is highly important and highly powerful tools and prevention and safety of everyone's health.
Yeah, yeah, absolutely. But what is the state of education in Afghan today? What's the state of education? Do you have more formal education? How do they communicate these things currently? And what will education look like in future? Because as you know, education is not just the four walls of the university. Education can come in different forms. So what is currently happening right now in Afghan?
Yeah, education has different types and everywhere around the globe. First of all, like at the beginning, everyone needs the basic education. Like in Afghanistan, we're having a basic education, particularly Islamic educations for the kids. After that, we're having a primary school for girls and boys together. So we also having and most focusing on Islamic education and having lots of facilities of Islamic educations for women and men, which which giving access to the girls for communicating, for learning the key important things in their lives and their religion lives, so they can learn in those facilities. Yeah.
Yeah. So is sexual and reproductive health education embedded in those curriculums? As in, like you talked about the Islamic education and all those forms of education. Is it embedded?
Yeah, in different ways it is, but mostly it's been focusing in the health field. Like when someone is doing getting education in the health field, so they're getting enough information about reproductive health information. But I would say that's not enough. Like when we just training a few numbers of female for this particular and important issues, and then we expecting from them to help the communities. So it's not enough at the moment. It needs to be more broad, and it needs to be more comprehensive, and everyone should have access. Particularly, it's now the world is absolutely changing. Everyone having access to the internet. Everyone have access to the social medias. It requires lots of initiatives to support Afghan women in this particular and important issues, either through the Islamic education centers, either through health fields, either through healthcare providers, or even from internet, social media, and other available sources that they have at the moment.
Yeah. Absolutely. Yes, support is what we want for Afghan girls. So all our listeners, we are making this podcast to create awareness that education is important. And like I said before, education is not just about the four walls of the university. There are other means of educating our girls, and it could be through community outreach programs on sexual and reproductive health. It could be through the health centers. It could be through religious organizations as well. Education can come in different forms. But one thing is sure, we must do it compassionately. Okay, for teachers listening, for healthcare professionals listening, for community leaders, for parents, What does compassionate support look like, Dr. Nabi? What can you tell us about supporting these girls compassionately? Because they're already afraid, okay? They're already afraid. There's already a culture of silence. So what does compassion look like in Afghanistan?
Look, if we compassionate, so it starts supports begin with how we communicate it. Like a girl who is ashamed will not come forward unless she feels safe, respected, and protected. A health care, like a healthcare culture in Afghanistan, it requires like a culture of dignity and non-judgmental care. So, for educator and community leaders, it helps to create this trusted pathways on this regard and safe spaces where girls can ask, explain, or discuss any sensitive question or any sensitive issues regarding their health, regarding their bodies. Even by their own language, it should be facilitated from educators and community leaders and community healthcare providers.
Yeah.
For a healthcare professional, I would like to add like it's essential to listening first and also asking permission before they examining something. It's a key rule for a healthcare provider, explaining what will happen and ensuring confidentiality as much as possible. And also, we should also make much easier possible for every girls, for every women that have access to this kind of services. And also we should make it easier, like I said, make it easier. No, it shouldn't be a big deal if a woman wants to discuss with a healthcare provider regarding their bodies, their sensitive topics. So it should be much easier, as much as possible. It should be easier.
Yeah. Yeah, thank you for that, Dr. Nabi. And as you know, Afghan has gone through so many wars and is a conflict region. And there's a lot of trauma that's been imposed on some of these young girls and women generally due to the war in those regions. So a trauma-informed care is also very important. Do you agree with me, Dr. Nabi?
Of course, I am agree with this because Afghan population is not just suffering from one problem; they are suffering from lots of problems, health problems. They in health field, like today we are discussing on reproductive health problems, but in the meantime they're focusing with the mental health problems. Even this reproductive health problems, this silence, this secrecy is also linked to the mental health issues, which is lots of women and girls facing at the end, and it's also a very very bad consequences of this silence and this secrecy.
Yeah. Thank you very much. And you did mention earlier, Dr. Nabi, about female-led support networks as well, very important for protecting the dignity of women in those regions as well, because a lot of young girls or women will be more comfortable around women as well. So a lot of development is needed in that area to develop more healthcare workers, okay, that understand trauma-informed care, that understand the cultural sensitivity, and also understand how to protect the dignity. And I'm saying this as well because a lot of Afghan people as well have migrated to the UK and are all over the world. So healthcare practitioners around the world should also understand that most girls coming or women coming from those regions may experience trauma. They may have some cultural sensitivity around how their care should be performed. And that should be put into consideration into their care and their plan for them to have a positive outcome.
Yeah, of course, it requires lots of development to yeah, to for their safeties, for a well being healthy communities. Yeah, it's as we discussed early. Just this is not only affecting women; it's affecting women, male, kids, even the whole family. It's affecting.
Yeah,
Yeah.
yeah, yeah. Thank you for pointing that out. Yeah, and before we conclude, because we are going to an end now, if an Afghan girl is watching you or a woman is watching you now, is listening, perhaps silently struggling with questions about her body, her health, her future, her reproductive health, majorly sexual and reproductive health, what would you want her to hear from this podcast? Because it's going to be going to a lot of people watching this podcast.
Yeah, of course. First of all, I want Afghan girls who are suffering to hear this clearly. Your body changes is not all a shame at all. It's not something as shameful, and you deserve a medical care at any point, at any time, and respect and support. If you're facing to any pain, any irregular changes in your body, you must discuss immediately with the person with whom you have trust, with whom you feel safe to discuss this. So please know that these are health concerns. These are health concerns, and that deserves attention, not secrecy, not silence. So you also deserve confidentiality. And also a kindness. So good care starts with the listening, and you have the rights to ask questions from anyone you trusted. Just be confident and discuss whatever you are facing, and please do that at the early stage. Early discussing at the early stage means it's early treatment. Please do not avoid this early treatment of your any health concern and any health issues.
Thank you very much, Dr. Nabi. In conclusion, sexual and reproductive health should never be a privilege reserved for a few. Every girl deserves knowledge. Every girl deserves dignity. Every girl deserves a safe healthcare and the freedom to understand her body without fear or shame. Silence protects stigma, but conversation protects lives. Thank you so much, everyone, for joining us on this important, very important conversation. And thank you, Dr. Nabi, for bringing that perspective and insight from Afghanistan healthcare. I really appreciate your presence here today. This is our Mother's Health podcast. Please do well to like, share, subscribe, and follow the podcast for more interesting content. So thank you, everyone. Thank you, and bye-bye.
Thank you so much. It was a really nice discussion, and I wish a healthy life for Afghan women. I wish a healthy life for all women around the globe. So wish you a healthy life. Have a nice time. Thank you so much.
Thank you so much. Thank you.